Hello, my name is Gentry, and I just wanted to share an experience that I had recently that has profoundly changed me as an individual. I recently was diagnosed back on March 7th, 2010, with a glioblastoma brain tumor, and out of the blue. I'm a 40-year-old man. I was in the best shape of my life, and all of a sudden I was diagnosed with this crazy experience, or crazy diagnosis. And I just wanted to share my story. You can edit some of that out. Long and short, I'll give you my symptoms first. I had been very forgetful. I had been leaving on the kitchen sink and the bathroom sink. I would go to the bathroom, I'd come out, sink would be running full blast, and my fiance would say, "Why are you leaving the sink on?" And I didn't even recognize that I had done it. I just walked out of the room, left the refrigerator open, had gone up to the rec center to work out, and came back out, and my car door was wide open, and left all my clothes in the locker in the rec center, and just little things like that. Thought maybe I'd had like a mini stroke or something, and so I had expressed concern to my mother and my fiance, and had talked about going up and getting a brain scan just to check and see if there was something going on. It was very atypical for me, and I wasn't thinking clearly. I was working on spreadsheets, and I wasn't able to process things the way I normally do. Usually I excel at Excel, and there you go. And I just wasn't thinking clearly. Well, Sunday after church on March 7th, we were walking the dogs here in the neighborhood, my mother and my fiance and myself, and I noticed, my mother noticed that I was kind of holding my hand in a little bit of a claw, and I was listing to the left as I was walking the dogs. And she insisted we go up to the emergency room. So we went up to the Dublin Methodist Hospital up there, and within 15 minutes I was on a CAT scan. I walked in and told them I felt like I'd had a stroke, and then within another half an hour they came back and said that they'd found a lesion on my brain, and it was pretty big. And so about 4 hours later, I was at Riverside Hospital. They transported me over and met with the surgeons and did another MRI. The MRIs are much more effective at looking at soft tissues within the brains than a CAT scan. CAT scans are better for bones and hard tissues. And so they did an MRI, and then 2 days later, they performed surgery on my head. You can see I've got a little scar here, and they pulled out a pretty good sized tumor. It was about 5 centimeters along its longest axis, and the surgery went very well. After the surgery, and I ended up with just an amazing surgeon, which in hindsight was God's providence, I am totally convinced. The surgeon that I was assigned to was called away on an emergency, family emergency in Iowa, and his doctor on call was Dr. Janet Bay, who's considered one of the best neurosurgeons in the country. And she just happened to be on call that night, and I ended up with her. As a matter of fact, Columbus Monthly did a survey on of doctors in Columbus, Ohio, if you had to have brain surgery, who would you pick? And Dr. Janet Bay came away far and away the majority. So I feel truly blessed that she was my doctor. And we hit it off, and so she performed the surgery that following Wednesday the 10th, and she took the tumor out and got 100% of it. I looked at the surgical notes, 100% of the tumor out. But of course, with this type of tumor, there's always roots that are left at the bottom that can regrow. And so basically she got it all out, which was very fortunate, and I feel blessed for that. So let's see. After the surgery, they tested my left side to see if there'd been any impairment with the motor cortex. The tumor, let me go back and say, the tumor was located in the right frontal lobe, which from what I understand, if you're gonna have a brain tumor, that's the best place to have a brain tumor because it's a quiet area of the brain. It's not an area where there's speech or vision or something that's going on all the time. It's a quiet area. So if you're gonna have a tumor, that's the best area. It's mainly short-term working memory and personality. And I've got plenty of personality, so I don't know if it affected that too profoundly, but it's the best place to have it. So long and short, they tested my movement after the surgery, and everything was fine. But as time progressed over the next couple days, the swelling in the brain started to increase from recovery from the surgery, basically where they took the tumor out, and it impacted my motor cortex, which then paralyzed my entire left side of my body. So I could not move my left arm or my left leg at all, or my stomach muscles, my back muscles. So I was pretty much paralyzed, and I wasn't thinking clearly. I mean, there was certainly a recovery there, and I've come to learn a lot about the brain, and I won't go into a lot of details, but basically the pressure was creating problems in the brain. And they had a hard time getting my pressure down for some reason. I don't know. I was on some medications, and finally the pressure came down, but it took quite a while for the pressure to come down. And I was in the hospital for about 2 weeks in intensive care over at Riverside, about a week and a half in intensive care, and then I was in a regular room for a couple days at Riverside, and then ended up over at Dodd Hall for physical rehabilitation after that for an additional 2 weeks. So out of the blue, I was in the hospital for a month. And let me tell you, when you're in the hospital for a month, things change. The entire left side of my body atrophied to the point, and I was in the best shape of my life. Like I said, 40 years old, I ran 4 races last year. I mean, I felt pretty good. I worked out regularly, and all of a sudden, here I am atrophied to the point where even when it came back, I couldn't lift against gravity. I mean, just putting my arm in the air like that was impossible. The gravity was so much that I couldn't overcome it. So I came home after Dodd Hall, and when I was at Dodd Hall, I couldn't walk. I mean, I was learning to walk again, and just to move my foot, to do this, just to kick my foot up was an impossibility. I couldn't move my leg or my arm at all. With extreme effort, I could lift my arm and try to get it up like this high. But it was really hard, and that was a very humbling experience for me, I have to tell you, to completely lose the left side of your body. They told me it would come back and it would take time, but I was learning to walk again. I came home in a wheelchair, completely paralyzed on the left side of my body. And I did want to mention too, that while we were at Dodd Hall, that, what was I going to, something just popped in my head I wanted to mention. I know you're filming it. You're going to edit all this, right?
Yeah.
Okay.
Take your time. You're doing great.
What was it? Okay. Well, I'll go ahead and go into. When I was at Dodd Hall, when I was when I was in the hospital at Riverside, it was a dark time. I mean, it was hard. The left side of my body was paralyzed, and I couldn't think clearly. They were asking me questions like, list the months backwards, and I was having a hard time doing it. Cognitively, it had affected my thinking, which has all returned, by the way. I mean, I feel much better now. Cognitively, I've been in some therapy, and everything's firing 100%, so I feel really good now. But when I was there, it was a dark time, and I never once even considered. I've had a strong faith since I was a kid. I've been saved for a long time, and I've got a personal relationship with God, and even at the darkest time, I never considered being angry at God or blaming Him for the situation or saying, why me? To the contrary, I was thinking, why not me? I mean, somebody's got to be in the path of the tornado. I mean, that's just the way God's plan is. And so I feel like I talked to God and said, you know what, God, I'm going to take you at your word. You made a couple promises. One, in Romans 8:28, you promised that we know that God causes all things to work together for the good of those who know and love Him, and those who are called according to His purpose. And in 1 Corinthians 10:13, He promised not to give us more than we can handle. And so I spoke to God and said, all right, God, I'm going to trust you. I'm going to say, okay, if this is your will and you're going to use this for your glory, then I'm going to trust you. And so I kept a positive attitude the entire time. And I feel like God truly stretched my faith at this time. I'd never experienced that before. I think that in the past, I've always been pretty capable of overcoming challenges and doing different things, but I could always kind of fall back that they were things that I was able to do myself. And I mean, I gave God the glory, but I think deep down inside, maybe I felt like I had overcome some of these issues myself. But this was an issue that I had to completely trust God in. And I think that was a profound experience for me. And I think I said, okay, God, I trust you. And if it's my time to go, it's my time to go. And I'm okay with it. And He, kind of like Job in the Bible, I think He took and He was holding me over the cliff, looking at the abyss, saying, do you trust me? And I said, I trust you. And He took me and set me back up on the cliff, and frankly has been showering me with blessings ever since. It has been an amazing, profound experience. My fiance has come to find Christ through this experience, and there's just been a whole list